is Jordana Guillén. I'm studying medicine at Catholic University. My subject is medical English, and the topic I'm going to talk about is low dose versus standard dose intravenous Alteplase in acute ischemic stroke. Definition: acute ischemic stroke is defined as permanent brain injury secondary to disruption of blood flow. Thrombolytic therapy with intravenous Alteplase at a dose of 0.9 mg per kilogram of body weight is an effective treatment for acute ischemic stroke despite increasing the risk of intracerebral hemorrhage. The enhanced control of hypertension and thrombolysis stroke study was designed to compare low dose with standard dose intravenous Alteplase in patients with acute ischemic stroke.
The scope of the talk this morning is to just briefly outline some of the pathophysiology of stroke in terms of how the anatomy informs some of the causation. But I want to concentrate on talking about the three evidence-based treatments that there are: organised care, intravenous thrombolysis, and hemicraniectomy for malignant MCA syndrome. And I'm not going to talk much about pathophysiology, but I think in terms of ischemic stroke, in a schema which is either that caused by penetrating vessel disease or large vessel occlusion through embolic or hemodynamic factors. So penetrating vessel disease, previously called lacuna stroke, the up-to-date term is small subcortical infarction, is characterized by hemi-syndromes of paresis, sensory loss, or ataxia in the absence of any cortical signs. The point about its distinction is that it's due usually to accumulation of rather diffuse vascular risk factors, and hence the causation is somewhat different, somewhat slightly skewed from large vessel occlusion.
Applications in medicine. In an international multicenter prospective randomized open-label trial with blinding outcome evaluation, 2 doses of intravenous Alteplase were compared in patients with an acute ischemic stroke who were eligible for thrombotic therapy. Patients were eligible if they were 18 years of age or older, had an acute ischemic stroke, and met guideline recommended criteria for treatment with intravenous Alteplase. We designed the trial to assess the effects of two treatment variables, Alteplase dose and intensity of blood pressure control or clinical outcomes according to their potential interaction.
Growing plaque can rupture, promoting thrombus formation by activating the coagulation cascade. Platelets and red blood cells aggregate at the site of injury, causing further narrowing of the artery. This impedes blood flow even more and causes turbulence in the artery. It also increases the likelihood of thrombus formation. As the thrombus grows, it causes increased vessel narrowing, leading to partial or even complete occlusion. The occluded artery leads to ischemia and tissue necrosis. When a piece of thrombus breaks off, it's called an embolus as it travels up the artery. During a stroke, ischemia can progress to infarction. Beyond the infarction lies still viable tissue called the penumbra. Cells within the penumbra are potentially salvageable if blood flow and vital oxygen are restored promptly. The penumbra is the focus of fibrinolytic treatment. Now let's look at the thrombus itself. Inside the thrombus are strands of fibrin, the protein that forms a clot. Enmeshed within the fibrin is plasminogen, the inactive precursor of plasmin. Acteplase is administered by IV infusion within 3 hours of acute ischemic stroke symptom onset. Acteplase binds to the fibrin in a thrombus and converts plasminogen to plasmin. Plasmin then breaks the strands of fibrin and dissolves the clot. As the clot dissolves, blood flow is restored, and viable tissue may be reperfused. Although the original infarction remains, when surrounding cells in the penumbra are saved or reperfused, function may be restored.
Pros and cons. Pros. Alteplase dose being completely faster than the part dealing with intensity of blood pressure control. There was no significant difference between the low dose group and the standard dose group in the overall reported rate of serious adverse events. Cons: significantly fewer patients in the low dose Alteplase group than in the standard dose Alteplase group had fatal cerebral hemorrhage events. The prospective primary outcome was the combined endpoint of death or disability at 90 days, which was defined by a score of 2 to 6 and the modified ranking scale.
A drug given quickly after a stroke can reverse the debilitating effect. ABC6 reporter Susan Burton now explains how it works and how much time you have to get the life-saving drug.
Helen Chapelier describes having a stroke.
My fingers got numb, the tips, and then my arm. And then I noticed my foot felt funny.
She was rushed to the hospital and given the drug TPA. Mount Carmel neurologist Dr. Ted Woodruff explains how it works.
A blood clot has formed somewhere within a blood vessel in the brain, and the tissue plasminogen activator, as its name sounds, activates another protein in the blood to dissolve the clot or break it apart.
The blood flow is then restored to the brain, delivering oxygen. But there's one caveat. The drug must be administered within 3 hours of the first symptom of stroke. If not, the damage has been done. Helen can't tell people enough to get help when you have the first symptom. The sooner the treatment, the better the chances of recovery.
By that evening, I could move my hand, my foot, and I was speaking. So it was amazing.
Stroke victims that cannot take blood thinners are not candidates for the drug, but can use mechanical clot busters. I'm Susan Burton, ABC6 on your side.
Hello.
Issues applying ECMO. Selection bias was due to the inclusion of patients who had a predominantly mild severity of neurologic impairment and who were treated at a later time point after symptoms onset than in the other trials, and then in quality assurance study of the use of Alteplase in patients with acute ischemic stroke. The high percentage of Asian participants and concurrent intensive blood pressure control in some patients may also raise concern about general disability, despite the finding that there were no significant interaction observed between Asians and non-Asians non-intensive of blood pressure control.
TPA is a medication that many people may have heard of, but it's important to know the indications, risks, and potential benefits. TPA is the only FDA-approved treatment for acute ischemic stroke within 3 hours of symptom onset. TPA is a clot-dissolving or clot-busting medication that can restore blood flow to the brain during a stroke. Eligible and carefully selected patients can receive the medication when they reach a stroke center within 3 hours of symptom onset. You should seek urgent medical attention by calling 911 if you or someone you know develop stroke symptoms. These include sudden weakness of one side of the body, sudden numbness of one side of the body, sudden difficulty with speech or language, or sudden severe headache.
Conclusion. In conclusion, in a group of predominantly Asian patients with acute ischemic stroke who were eligible for thrombolysis reperfusion therapy, a dose of Alteplase of 0.6 mg per kilogram was not shown to be non-inferior to the standard dose of 0.9 mg per kilogram with respect to the primary outcome of death and disability. Fewer patients treated with low-dose Alteplase than with a standard-dose Alteplase had the secondary outcome of symptomatic intracerebral hemorrhage. Thanks for your attention.